Thank you for joining us here on KAMR Local 4 News. The City of Amarillo is preparing to have a briefing about the coronavirus pandemic. We're taking you live now for this breaking news.
We're going to go to some brief statements from each member of our panel, and then we'll open it up for questions from the media. I want to go ahead and start this time with Amarillo Mayor Ginger Nelson.
Good morning, everyone. Hope you had a wonderful weekend, and if you're a mother, then I hope you felt very appreciated by those that love you and those that you love and mother. Here in the city today, we still have the CDC team working on our COVID issues. And we also have, of course, testing going on at some places, the Texas Military Force winding up that testing from last week. As those testing numbers come in, I want citizens to be prepared for our positive numbers and our active case numbers to go up. Just not anything different than what we talked about last week, but just a reminder that we're going to continue to see our numbers rising as those cases develop and as the people that are exposed to those cases test positive. So we know that's going to happen. We're not going to be surprised by it. We're going to use that data to create better strategies inside those work environments and those family environments to help slow the spread and watch our hospital capacity. I want to say thank you to all of the business owners and especially to our restaurant owners who have been doing such a diligent job in reopening their businesses. I'm hearing positive comments by citizens who are visiting. One citizen in particular said he was so glad to have Mexican food again. So thank you for the diligence that you're using to abide by the governor's standards on reopening your business. And if you're a business owner who's chosen not to open, I respect that. And I thank you for doing what you believe is the right thing for our community. And speaking of community, many of you are choosing to hope through this situation. And that hope is a very important component of getting through this challenge. And last Friday, I was able to visit quickly the pop-up pantry where people were spreading hope in our community by passing out food, about $50 worth of groceries in each packet to 2,000 families. And I heard over and over again what a great partnership it was in the community, not just with our police department and our internal city staff team that worked out logistics, but with the volunteers, over 200 volunteers from Hillside Christian Church and other food related, the High Plains Food Bank, and just so many people who donated food from our agricultural community. That really gave me a tremendous amount of hope going into the weekend and into this week too. I know that our city is rising to the occasion and the challenge of this situation, and I hope you're feeling that hope and choosing to participate in spreading hope as well. Thank you, Dave.
Thank you, Mayor. This time we want to go to Casey Stoughton, Public Health Director, City of Amarillo.
Thank you, Dave. As of this morning at 10 o'clock, there were a total of 1,533 cases of COVID-19 reported in Potter and Randall counties. In Potter County, there was 1,159 cases, and in Randall County, 337 cases of COVID-19. We have a total of 284 recoveries, and we're thrilled about each of those recoveries. And we are holding steady at 18 deaths reported in our community. We are certainly, our thoughts and prayers go out to each of those the families. That leaves us with a total of 1,231 active cases in our community. The numbers reflected on the 230 report card will have different information as we are entering data currently. The drive-through testing site continues today. That's provided by Amarillo Public Health and the Texas Tech Health Science Center. It continues today until 3. Our call takers are ready to screen and direct people for testing at 378-6300. So far, over 3,100 people have been tested at the drive-through testing site. We're really encouraged by that number. We appreciate all of our partners, including Potter County, City of Amarillo, and the Tri-State Fairgrounds for that testing. We anticipate additional test results coming in shortly with the additional tests that have been done in our community. We're trying to be responsive on the report card, and so we're going to take just a moment to walk through the report card and the changes that you'll be seeing. So we're going to take just a second to put that report card on the screen. There you go. And so we're going to walk through some of the changes that you're seeing. We'll start in the top left-hand corner on the cases. you see total cases. So Potter, Randall counties, those are familiar to you. Active investigation, that line right now reflects 0 on Saturday. However, Friday there was 1 case there, and that meant that there was 1 case or 1 person who was reported to us, and that they didn't have an address, and so we couldn't accurately define which county they lived in. And so as our team works through each of those investigations, you can see we were able to categorize their county as either Potter or Randall, or we moved them into our out of jurisdiction section. And so as those cases that are in the active investigation section there, as we move through those, then they will be moved into the appropriate section. So you see total cases, and that's the total number of positive cases that we've received reports of. Recoveries would be minused out of the total cases, and those recoveries are those people who have recovered from COVID. Deaths would be those people who have died from COVID. And then the active cases, you see for Potter County, 951 active cases. That's the total cases minus the recoveries and minus the deaths would give us the active cases for that specific county. When we look at sex, we have male and female, and you can see in active investigation, there are 46 persons who are currently actively investigated. That means that with the information that was sent to us, it did not list their gender. And so as we move through that investigation, we will put them into the section that they belong once we know what their gender is. Age, you can see the breakdown of the different age categories, and these age categories, some of them have large categories, especially the 0 to 19 and the 80 plus. Those are large age categories, and so that's just important to note. When you move down to the daily plus or minus, we feel like this is an important section so that you can see the total new cases for the day. On Saturday, we had 23 new cases in Potter County and 3 new cases in Randall County. If there were any under active investigation, meaning that we didn't know what county they were in because that information wasn't reported to us, that would be there in the AI section. The net active cases is, this is the report card for May the 9th. So it is the active cases for May the 9th minus the active cases for May the 8th. And that gives you the net active cases for that day. And what we want is that number to be negative. So we want for the trend to be going down. That number has been positive each day except for May the 9th. And so this was a red letter day here on May the 9th because it was the first day that number, the net active cases, was negative. Saturdays and Sundays tend to be lower reporting days for us, and so we certainly hope that negative number there on the net active cases holds steady for us as we move forward. That's what we want to see there. The tests, those would be all of the tests conducted that have been reported to public health, and then the number of tests pending. We will see both of those numbers increase as we move through the next few weeks, or the next few days actually. So those are the changes that you'll see on the report card. We hope that the information here is helpful to you. We appreciate your feedback, and if there's additional information, then we certainly want to be responsive to you. We anticipate a dashboard very soon. We have it ready to go. We just, it didn't look really good on a mobile device, and so we're working out those bugs, and then it'll be ready to go so that you can see it both on the web and on your mobile device like your phone or your iPad. So once that's ready to go, you'll have a dashboard that'll have even more information. So that's all I have, Dave.
Thank you, Casey. At this time, I want to go to Dr. Scott Milton, Public Health Authority, Texas Tech University Health Sciences Center.
Yes, good morning. I wanted to remind everyone that it's important that we continue to practice social distancing, that if you have to be out in the public, you should wear masks, and please avoid large groups. To date, we've given 32 transfusion of convalescent plasma to individuals in our community, and we are continuing to receive local donors. The hospitals, I don't have the specific numbers for the day, but over the weekend, I can say that our capacity has been stable and adequate, and the impact on from COVID on our hospitals is manageable, remains manageable. And finally, I just heard that there's that our community is going to be receiving a small amount of remdesivir. Remdesivir is a antiviral medication that has some activity against COVID. I don't think it's a home run, but we are going to be receiving a little bit in our community, and I'll be going over the details with that with the pharmacist at the hospital, so we can have another tool in the tool bag for utilization for this disease. And that's all I have.
Thank you, Dr. Milton. This time we're going to go to City Manager Jared Miller.
Thanks, Dave. Public safety calls are still trending below average versus this time last year. Today, calls are for the police department, they're down 25%, and for the fire department, they're down 8%. Ambulance calls are down about 14%. We've still gotten a lot of calls, or a number of calls, over the weekend about businesses not complying with the governor's order. We've been responding to these calls through our environmental health department and fire marshal's office to help work with these businesses to find the best way to be in compliance. And they've all been very responsive to that outreach. I want to remind everyone to sign up for AmarilloAlerts.com. AmarilloAlerts.com. Go to that webpage and sign up to receive timely reminders or notifications about current and factual information on a variety of events, including COVID-19. Last week's Pet Pantry, we served 792 people at the Pet Pantry. It's going to be open again this week on Tuesday and Thursday afternoons from 3 to 6 p.m. at Thompson Park. Just want to continue to recognize and share appreciation for Merrick Pet Care for their partnership in donating all this food. It's really made a huge difference in our pet community. The pop-up food pantry. Last week on Friday morning at this very same press conference, we talked about the pop-up food pantry that was going to happen at 1 o'clock. The mayor talked about it. It was just a huge success. Want to echo the mayor's gratitude. We were able to help over 2,000 families through that effort, and all of the credit for that goes to the nonprofits and agriculture businesses that helped make that possible. Also want to finally just do one more update on the governor's executive order GA-21. We're currently under GA-21 and will be so until May 20th. It superseded GA-18, where that recommends that people over 65 are strongly encouraged to stay home as much as possible and maintain appropriate distance from any members of the same household that have been out of the residence within the previous 14 days. That's just to make sure that we can do the very best we can to protect at-risk populations, and the data shows that the majority of our fatalities, both locally and nationally, fall into that category over 65. Also, essential services remain the same, plus recommending houses of worship conduct religious services in accordance with the joint guidance issued by the AG, the Attorney General, and the Governor. Reopen services that began on May 1st that can operate up to 25% of their occupancy are in-store retail services, dine-in restaurant services, movie theaters, shopping malls, museums, and libraries. Then we, this last Friday, had an expansion of that reopened services that began May 8th, or last Friday, and that included cosmetology salons, hair salons, barbershops, nail salons, tanning salons, and private swimming pools. Reopened services are going to expand again next week on Monday, the 18th. And that's going to include office buildings up to 25% of their total occupancy, manufacturing services again at 25%, and gyms and exercise facilities also at 25%, with some additional restrictions on locker rooms and shower facilities and things like that. More detailed guidance on how to best operate essential services and reopen services can be found in the document put out by the governor called Texans Helping Texans, the Governor's Report to Open Texas. And as I said earlier, when talking about calls for service from public safety, the Environmental Health Department and the Fire Marshal's Office will continue to monitor for compliance to the governor's executive order and respond to calls of people wanting to report possible noncompliance. That's all I have, Dave.
Thank you, Jared. At this time, I want to open it up to questions from local media. We have a question for an individual panel member or the panel.
And we'll continue with the latest coronavirus coverage on air and online. And to keep up with the latest, you can visit our website at myhighplains.com. For now, let's send it back to regular programming.
187 people. So they did a tremendous job, and we appreciate all of their help. That was Wednesday through Saturday. I can get all the breakdowns of each of the numbers for you, but I'll need a little bit of time.
Okay. This next question is for Mayor Nelson. Do we know right now if the strike force is staying any further, or is that being discussed today?
Well, there's two different components of help that came as a result of our request. One is the CDC surge strike force, and that they brought expertise to look specifically into our meat packing plants. And they are still here working on their report, and we'll be working with them on the recommendations that they have. And then the second component is the Texas military force who came to do the testing at Tyson. And Casey, I probably need you to answer that. I know there have been some conversations about them staying longer in our city, but you may have more specific information about where they're going or what they're doing next.
I have not heard that they're going to be testing any more large groups.
So it's possible that their deployment will end, yes, just as long as it takes them to wrap up the final, what they're working on at Tyson, which would be, I would think, the next day or two.
Okay. And this next question is for Mr. Miller. Does the JBS plan have more than one location they bus people to and from in Amarillo?
I'm not aware. The only one I'm aware of is Walmart, but it's very possible they may have more pickup locations.
This next question is for Casey. Do we have any numbers associated with the number of cases from secondary contact with JBS employers or the TDCJ employees?
So yes, and I can get that information. Any numbers, specific numbers that you need, it's helpful for me if you can give me those ahead of time so that I can pull that data for you, because I want to be responsive and give you that number. However, I don't always have, I try to have the numbers that we've asked for in previous press conferences. I try to have those numbers written down beside me, but when there are new numbers that are asked for, I don't always have those just on the top of my head, so I certainly can get that for you. But if there's specific information that you need during these press conferences, if you can get that to me ahead of time, then I can absolutely be responsive during the press conferences.
Okay, will do. And Dr. Milton, you talked about some medication earlier. Can you talk a little bit about kind of what that medication is and what made us want to, get that medication?
Are you referring to the drug remdesivir?
Yes, sir.
Yeah. So that's a drug that is, I believe, manufactured by Gilead, and I think they've had it on the shelf for quite some time, but they've been trying to find a use for that. And there's been some data that has been shown that if it's used in patients that have COVID, that the clinical course may be improved, and it seems to be that it's reasonably well tolerated. So it seems to be that the initial data shows that it's safe to give, and so it was released for approval by the FDA about a week or 10 days ago, and so there's limitations on that drug. I think one limitation is it can only be given intravenously. It can't be given as a tablet. So that makes it more difficult to give to people outside of the hospital, obviously. But I think that what we'll try to do is see how much of a stock we have. I don't know exactly how many doses we have. And then we'll just try to select the best patients where we think we can get the best impact. Most of these drugs and treatments, I think it's fair to say that you want to try to treat individuals as soon or early in the course of the illness and have the best impact. Is that helpful?
Yes, sir. I have no further questions. Thank you, guys.
Thank you, Jack. This time I'm going to go to Ramon Godoy of the El Mencionero newspaper. Ramon, how are you?
Good morning. Thank you, Dave. My question is regarding this case you mentioned about 3,500 tests performed, I assuming, around Tyson plant. When do you expect to get those results back?
I think we should get those results back sometime this week. So we look forward to working with each of those individuals sometime this week.
What happened with that people? They still working? They still on the side job, or they are on quarantine, or is anything else happening with them?
So that's a great question. It depends on the individual person. So if they're not symptomatic, if they're not sick, then they're probably still at work. If they're sick, then we ask that they be able to go home.
And the last question is, out of those 3,500 people test, is anybody so far reported as positive by symptoms, or anybody in another plant is reporting and the strike force is just working on Tyson plant, or they are moving around on the other plants?
So the testing was only completed with Tyson employees. And so we anticipate the results of those tests later in the week. And so we'll be able to have more information for you when those test results start to come in.
Okay, thank you.
Thank you, Ramon. This time I'm going to go to David Gay of the Amarillo Globe News. David, how are you?
Morning, everybody. Hopefully everyone had a great weekend. My first question is for Casey. And you may have gone over this in a previous news conference. I just wanted to ask, what additional information will be featured on that dashboard that's about to be released?
So there will be, our IT department has done a really nice job of putting that together for us and making it so that we can update it daily, but it'll have the total case counts. It will have graphs and charts related to deaths and the total case counts and genders, and it will we're working on a way to have zip codes on there. That has been a challenge for us since we have 2 counties. The programming that's associated with that has been a challenge. So when it comes up today or tomorrow, you won't see the zip codes. You'll just see a map with our 2 counties, but the zip codes are soon to come. There will be a cases per day, so it's what we call an epi curve, but you'll see a bar chart with the case counts per day. And so I think you'll see there'll be information on there that's very similar to Houston, Harris counties, and the state of Texas. If you go to the DSHS website that's listed here on the daily report card, that dashboard mirrors the information that's on the dashboards there.
Okay, fantastic. Thank you for the clarification. Dr. Milton, regarding this new drug, you talked a little bit about it with Jack, but I just want to ask it one more time. I mean, to determine who kind of is receiving this new drug in the coming days, is that a conversation that will be had with hospitals and with the patients who most need this kind of new treatment?
Yes, I mean, utilizing the drug is to where I think we're going to try to look at individuals who we think may benefit from it most. And as I mentioned, it would be best to try to catch people in a window that would be at increased risk of having a complication and maybe hasn't developed their full clinical course, or that they haven't gotten quite as sick. And maybe we could blunt that. I think that would be the strategy. I mean, in other words, maybe we could try to use this on individuals before they develop respiratory failure. That would be, I think, one avenue of how we would try to judge where it would be best utilized.
Absolutely. And I guess with this new drug, I mean, what have you seen from, I guess, I don't know if other hospitals in the state have used this, other hospitals in the country have used this. I mean, what have you seen, I guess, the impact of this new drug being on these kinds of patients?
This drug is not a home run. It's not a home run. What has been shown is that it seems to be safe to give and that it may blunt the severity of the illness in patients who've received it.
Okay, fantastic. No further questions. Thank you, guys. Stay safe.
Thank you, David. This time we want to go to Ariana Martinez of News Channel 10. How are you, Ariana?
I'm good. Good morning, everyone. For either the mayor or Casey, do we have any of those updates from the CDC and USDA that they're compiling, or are they still working on it for those recommendations?
They're still working on that. They worked over the weekend and they're still working on it. We don't have a draft yet of that information, but we look forward to working with them as soon as we do.
Perfect. And is there any consideration of using fast detecting antigen tests? And what are the benefits or downsides to them?
There was a new antigen test that was approved, I think, over the weekend. And the advantage to that, from what I've read, is that it's quick and it's cheap. It's probably not as accurate as some of the other tests, but there's going to be some usefulness there, I think, in terms of just trying to do more screening of individuals. So that's what I know about the new antigen test.
And is that something we have available here in Amarillo?
I don't believe we have that as of yet. I think it was just approved over the weekend. I just read that on the news reports over the weekend.
And then this one's probably for Jared Miller. How is the 25% occupancy being enforced? And then are businesses respecting the limit? And what are the consequences for not complying?
The enforcement is both environmental health and fire marshals proactively going to businesses, but primarily it's response-based. Because we get so many calls for response or of concern, a lot of our time is spent going to those businesses. In every case, we've evaluated the situations they have, discussed it with their managers, looked at their certificate of occupancy that has their loading limits, and applied that to their customer counts. And we have worked with them to have the appropriate distancing between tables, or, if you're talking about a restaurant or, whatever other business you're talking about, the retail businesses and other things, to make sure that their occupancy counts are in accordance with the requirements of the governor's orders. They've always been very receptive, but that doesn't mean that there aren't violations. So every time we find one or learn of one, we go talk to them, and they've been very receptive to making modifications to their operating practices to ensure that they're staying below the 25% limits that are set by the governor, or the other limits in certain other businesses.
Perfect. And then is it like the first time they come out, you help them? Is there any consequences for maybe the second or third time or anything like that? I'm
not aware that we've had any repeat violations, but at some point there would be violations. We don't, or citations. We've not had any as yet. So that tells you kind of what we're getting as far as responsiveness.
Perfect. Well, that's a good answer. And what are the numbers for senior living testing in cases of residents and staff?
Sure. So we have had 14 residents and we've had about 10 nursing homes affected. And when we talk about that, we're talking about the entire public health district. And so Potter and Randall counties together.
Okay, thank you. And for the demographic of cases, will that also be on the dashboard, or will we have that available?
Do you mean what's
like for the public reporting of demographics for the COVID? Will that
mean age or?
Oh, I'm sorry, like race and ethnicity. Sorry.
I'll have to check. I'll have to check to see if that is a component or not, but I'll check.
Perfect, thank you. And that's all I have.
Thank you, Ariana. At this time, that concludes our questions to the media and concludes our news conference. I want to thank our panelists for joining us and taking the time to provide this valuable information to the community. Once again, we do this every Monday.
I forgot to look. I'm like, am demographics. Like
at 11 a.m. And we will see everyone again on Wednesday. We appreciate everyone's time and thank you very much.
Thank you.
Thank you.
Ya no me dejó hacer otra pregunta.